Good morning.
Hi.
Now you're here to talk to me about breast reduction surgery?
Yes.
All right, fantastic. What are the main concerns? What's troubling you?
Basically, I just feel that they're too large. They've been like this for like a couple of years now, and I'm finding that a lot of clothes are really hard to find that fit, and also it's kind of painful.
You know, particularly when you exercise, run, the jarring and just too sore and uncomfortable. Yeah, what size are you?
An E.
E cup.
Yeah.
Yeah, you know. Now with an E cup breast, you know, all those sort of problems or concerns are, you know, obviously common. It's a heavy breast, and it's going to, you know, cause not only physical problems like pain and strain in the neck, but also, you know, functional problems like fitting clothes. No problem. I mean, it sounds like you'd be a good candidate for breast reduction surgery in that case. What I would like to do is just explain some of the things that we need to go through to make the decision, all right, and exactly how you make the decision. So I'll take you through the planning of the operation, you know, how it's physically performed, and also what happens after the surgery, all right. The first thing that I need to do is to examine you, all right. We'll do measurements, we'll do some photographs, and then we'll sit down and talk about the specifics of planning the operation for you. Can I just ask, what size would you like to be when the surgery is done?
I guess it's smallish as D.
Yeah, okay, D cup, all right, that's fair enough. So we're looking at about 3 cup sizes reduction, 3 or 4 cup sizes. Yeah, that's fair enough. All right, and that's a realistic sort of expectation, because you'll find that when you're reducing the breast and removing breast tissue, we have to be careful, again, not to overdo it, because the more breast tissue that's removed, the more we're jeopardizing the blood supply and circulation to the remaining tissue, all right? And the more you remove, the more risks we run of things like not being able to breastfeed, you know, having decreased sensation in the nipple, all right, or even losing skin. So we've got to be careful not to overdo it, and that's why I think it's a good idea to keep the expectation, you know, kind of conservative, C to D cup, you know, so that we can do this procedure well and we can do it safely. All right, so let's have a look at you, and we'll do the planning in a minute. All right, very good. Now we've had a look at you. I've done the measurements, and look, there's no question about it. You've got a full breast, but I do think that you'd get good result from the reduction surgery. You know, you certainly get improvement in the neck pain, the neck strain. You know, possibly even the headaches being improved. You know, and certainly it'll help with fitting your clothes and bras for sure. Well, let's go through the how the surgery is performed. All right. This is an operation that takes about 2.5 up to 3 hours to perform, and you expect to be in hospital anywhere from 1 to 2 nights. All right. The main reason that we keep you in hospital for this operation is that I use drains. All right, and the drains generally stay in position for 1 or 2 days. All right. You know, we don't want the fluid that's generated by the surgery to collect, all right, because it can then cause other problems. So again, it's a safety issue. All right. The breast reduction operation involves essentially 2 components. All right. You get a breast lift, so that we're making the nipple higher, we're making the overall breast sit in a higher position. And the other part is obviously the reduction, so we're reducing the volume and the amount of breast tissue that you've got. All right. So you get 2 benefits.
Yeah.
Alrighty. So now the next thing that we need to talk about is what happens after the operation. All right. So you've woken up from surgery. You have dressings on. The dressings that we use are twofold. The first is the first layer is a tape. All right. And on top of that we have gauze and surgical tape. All right. Now the outer layer of the dressings only stays on for about 48 hours. Then it's removed, and all you end up with is the tape directly onto the incisions. All right. Those tapes stay on for about 6 weeks. Okay. Looking after your incisions once you get home is pretty straightforward. You essentially leave them alone. All right. The surgical tape stays as is, and you don't have to do anything to them. There are no stitches to remove. All right, because all the sutures that we use are self-dissolving, so there's nothing for you to do. All right. I would see you back the week after surgery, and then about 6 weeks after the surgery again, just to make sure that everything's progressing well and there are no concerns. All right. In the first few weeks, the only thing that you have to do is really be careful about how much activity you do. All right. Make sure you don't do heavy work. No exercise for about 4 weeks. We'll try to make sure that you don't go to the gym and start lifting weights. All right? Those sort of activities are going to make it more likely that you'll have a problem like stitches pulling apart or have bleeding after surgery, which obviously we don't want. So you've got a reduction in the amount of physical activity that you do after the operation, but really once you get past about the 6-week mark, you're pretty much right to do most things. All right. The only things that I would ask you not to do for about 2 or 3 months is heavy contact sport, and that's about it.